All right, everyone, welcome. Today we're diving into a topic that is absolutely foundational for pediatric dentistry, dental anomalies. And listen, this goes way beyond just looking at teeth. This is about changing young lives. So let's get right into it. This quote, right here, this gets to the very heart of why we're having this conversation. You're going to see these cases. And the reality is, many kids aren't getting the care they need because clinicians feel overwhelmed. Our job today, and in the lectures to come, is to give you the confidence to see a case that seems too difficult and turn it into a challenge you are absolutely ready to take on.
So, here's our roadmap for today. We'll start with why this is about more than just teeth. Then, we'll talk about the principles that will guide your management. We'll cover why you can never do this alone. It absolutely takes a team. We'll map out how teeth develop to see where things can go wrong. And finally, we'll talk about your future role in all this.
Okay, first up, you need to understand that when we diagnose a dental anomaly, we're often looking at something with genetic roots. And what that means is, a diagnosis for one child can have these huge ripple effects for the entire family. And this is exactly where your job gets so much bigger than what happens in the clinic. You become a guide. See, genetic counseling isn't about telling a family what they should do, not at all. It's about giving them the clearest information possible so they can make informed decisions that are right for them. The amount of trust they place in you here, it's just incredible. So if the genetics is kind of like the map of the terrain, how do you navigate it? Well, that's where these principles come in. You can think of them as your clinical compass. They're going to guide every single decision you make for these patients. Look, treatment here is never a quick fix. It's a journey, and it has 4 really critical stops along the way. First, you nail the diagnosis and counsel the family. Then, you do what you can to immediately restore function and aesthetics. After that, you've got a plan for the intermediate phase, navigating those tricky teenage years, all while keeping your eye on the prize, the definitive, long-term treatment. And let's talk about those teenage years, because honestly, this can be the toughest part. You're dealing with a patient who is, quite rightly, intensely focused on how they look right now. But clinically, it might be way too early for their permanent restorations. So you're in this constant balancing act between their immediate social and psychological well-being and the long-term health goals. It's a very, very delicate dance. All right, now for what might be the single most important slide of this entire lecture. When it comes to these complex cases, collaboration isn't just a nice idea, it is everything. You simply cannot and should not try to do this alone. And this is what that team looks like. You, the pediatric dentist, you're often the quarterback, coordinating everyone. But you need your orthodontist, your prosthodontist, and just as critically, your clinical psychologist. I had a case, a young girl whose teeth were so fragile she couldn't eat properly and was afraid to smile. The prosthodontist had this amazing plan for her future, but it was the psychologist who pointed out the devastating social impact it was having on her today. That one piece of insight completely changed our immediate plan. That's the kind of magic that only happens when you work as a team. Okay, let's switch gears. To really understand what went wrong with a tooth, you have to have a crystal clear picture of how it was supposed to form in the first place. We can actually classify nearly every anomaly just by figuring out at which exact stage of development the error happened. It's like having a developmental map.
And here is that map. The whole process is like a biological production line. It starts with the dental lamina, the very first signal to build a tooth, and it goes all the way through to eruption. Every single step has to happen perfectly. A hiccup at any one of these stages leads to a very specific kind of problem. Let's walk through a few.
So at the very beginning of the line, you have the dental lamina stage. This is all about getting the numbers right. It's like the head count for all the teeth. If the signal is too strong, you get too much proliferation, and boom, extra teeth or supernumerary teeth. If the signal's too weak, you get hypodontia, missing teeth. This is the foundational blueprint.
Okay, next on the line is morphodifferentiation. It's a mouthful, I know, but all it means is shaping the tooth. This is where the cells arrange themselves to decide, am I going to be an incisor or a molar? If this stage gets disrupted, you end up with teeth that are too big, too small, or have weird shapes, like a talon cusp. This is where the tooth gets its unique form.
So once you have the shape set, you've got to build the structure. That's matrix deposition. Think of it like pouring concrete into a mold. And if the concrete mix, the enamel or the dentin, is faulty, the whole structure is weak. That's exactly what we see in devastating conditions like amalganosis or dentinogenesis imperfecta. And finally, you can have a perfectly formed tooth, but it still has to make that final journey into the mouth. The eruption phase is where things can still go wrong. You can get impactions, where teeth just get stuck, or ectopic eruption, where they show up in the completely wrong place. The tooth itself is fine, but its path is blocked.
So we've covered the what, the how, and the when. But let's wrap up by talking about the most crucial component in all of this, you. Your role is so much more than clinical skill. It's about how you lead with compassionate, patient-centered care.
If you walk away with just a few things today, let it be these. Diagnose as early and as accurately as you possibly can. Collaborate like your patient's future depends on it, because it does. And always, always bring the child and their parents into the circle as true partners in their own care. Because at the end of the day, we're not just treating teeth, are we? We're improving a child's entire quality of life.
So I'll leave you with this question to really think about. As you move forward in your careers, what is your role on this team? Are you going to be the expert diagnostician, the master coordinator, the compassionate supporter, the fierce advocate? The truth is, in these cases, you have to be all of those things. And that right there is both the challenge and the incredible privilege of doing this work.